Hello, this is Miles with Best Practice Medicine. Extremity splinting is one of the fundamental skills of the EMS provider. In this video, we'll be going over the fundamentals of effective extremity splinting. The fundamental components of extremity splinting are laid out in the NREMT Psychomotor Skills Sheets published by the NREMT or your state EMS administration. These fundamental principles include selection of the proper personal protective equipment, manual stabilization of the injured extremity, assessment of the patient's distal circulation, motion, and sensation, selection and application of the most appropriate splinting material to immobilize the injured site, as well as the adjacent structures above and below the injury. And finally, concluding with a reassessment of the patient's circulation, motion, and sensation. While it's possible for students to memorize these skill sheets and recite them fairly easily in order to pass the test, at Best Practice Medicine, we place our focus on practical skills mastery and complex clinical decision making. Because we want our students to be highly adaptable and prepared to make good decisions in the field, we teach a variety of different applications of these fundamental principles. In this series of videos, we've demonstrated a number of these elements applied in a variety of different injury patterns. To help prepare you and to aid as a follow-along resource, we've included a link to download the skill sheets in the description below. When studying the skill sheets, be sure to pay close attention to the critical criteria at the bottom of each sheet. These critical criteria are elements that the student must correctly perform as indicated in order to successfully pass the station. We hope you enjoy this series and find it informational and useful to your clinical practice. If you want us to cover any specific topics, let us know in the comments below. As always, thanks for watching.